Okay, let's talk about diseases that are associated with low levels or reduced levels of glutathione. And this is not at all intended to be a list that is the master list, because theoretically glutathione, because of its role centrally as an antioxidant, understand that every disease, every chronic degenerative disease that is inflammatory in nature, glutathione helps the body with that inflammation. So we could really draw inference that any inflammatory disease could be contributed to, in a sense, by lower levels of glutathione, because glutathione is what our body uses to protect us from inflammation. However, that being said, there are specific diseases that have been studied and researched and linked to low glutathione. One of those is neurodegenerative disease, and specifically in neurodegenerative disease, multiple sclerosis is a type of immune, but also a type of neurodegenerative disease, dementia, as well as Parkinson's. So these have all been linked to glutathione being low. Heart disease, this includes hypertension and increased risk for heart attacks or myocardial infarction. We also know that chronic liver disease is associated with loss or lack of glutathione. We know that autoimmune diseases like lupus and rheumatoid arthritis are linked to glutathione deficits. We know that people that have uncontrolled diabetes, that not only can that cause or contribute to low glutathione, but low glutathione can make it harder to control diabetes. We know about infertility, as it's especially true for both men and women. So it's not just ladies, because a lot of times women are blamed on infertility, but this is also for fellas, for men. And one of the reasons why is that the sperm cells themselves, this little tail on the back of the sperm, its ability to move or generate energy, it impacts the sperm's survivability. It impacts the speed at which the sperm can swim upstream and fertilize an egg. The sperm also requires tremendous antioxidant to protect it while it's on its journey. And the main antioxidant that's helping to do this is glutathione. So a lot of times we'll see men with low glutathione will have low sperm quality, or sometimes what's called viability. Your sperm will die too quickly and can't make the journey. So remember, glutathione also protects the female's eggs, so it works in both men and women. And then we have a number of different mental health disorders. We know that many of these disorders, like bipolar and depression, are actually inflammation manifesting neurologically in the brain, and glutathione certainly can help with that. Now let's look at some of the research studies specifically. Again, this is not intended to be an ultimate comprehensive review on all the research around the diseases linked to glutathione, but let's just look at a few of these studies. So you see here, glutathione is generally a safe ingredient for use and is regarded as food or health supplements in most countries. While it is considered a pharmaceutical agent, I think it's important to point that out. Glutathione is so powerful that many countries consider it to be a drug for the treatment of illness and disease. So in some countries, it's considered to be a pharmaceutical agent. It could be used as both as a protective and a therapeutic agent against several diseases. Important to understand that kind of synopsis of glutathione. Now, also have some studies here specifically. We'll check these out. So you can see this was published in Frontiers of Neurology. Glutathione, a Samsonian life-sustaining small molecule that protects against oxidative stress, aging, and damaging inflammation. Again, an anti-inflammatory. So let's just paraphrase here. Many local and systemic diseases, especially diseases that are leading causes of death globally, like chronic obstructive pulmonary disease, like asthma, atherosclerosis, with ischemic heart disease and stroke, cancer, and severe acute respiratory syndrome, like COVID, causing coronavirus, involve both oxidative stress with excessive production of reactive oxygen species. Remember, that's the function of glutathione. It's to neutralize those. that lower glutathione levels. Therapies enhancing glutathione could become a cornerstone to reduce the severity and fatal outcomes of inflammatory disease as well as COVID-19, and increasing GSH levels may prevent and subdue these diseases. GSH depletion as a fundamental risk factor for diseases like chronic obstructive pulmonary disease and atherosclerosis. Importance of oxidative stress and antioxidants in SARS-CoV-2 infection and COVID-19. 3, significance of GSH, that's glutathione, to counteract persistent damaging inflammation, what they're calling inflammaging. Again, excessive inflammation accelerates aging, and early premature inflammaging associated with cell and tissue damage caused by excessive oxidative stress and lack of adequate antioxidant defenses in younger individuals, and new therapies that include antioxidant defenses and restoration. So again, a lot of that, if we paraphrase a lot of that, it's that a lack of glutathione can accelerate inflammation. Many diseases that are inflammatory in nature will burn through your glutathione levels, making glutathione a suspected therapeutic agent that could be used in the potential for treating a lot of these different types of problems. Again, that author's opinion. Let's look at some of the research here. You can see here research in atherosclerosis. So they did a study, and this is a human study, on 114 healthy non-smokers without known clinical atherosclerosis who had carotid intima thickness measured. In other words, this is a test that measures the carotid artery and whether or not there's any type of atherosclerotic plaquing in that artery. As well, oxidative stress was estimated by measuring plasma levels of glutathione, an important intracellular antioxidant thiol, and its oxidized disulfide GSSG and their redox status, as well as measuring cysteine, an important extracellular antioxidant used to help produce glutathione. Conclusion results here: glutathione, an in vivo measure of intracellular oxidative stress, is an independent predictor of the presence of early atherosclerosis in an otherwise healthy population. This finding supports a role for oxidative stress in the pathogenesis of premature atherosclerosis, and its measurement may help in the early identification of asymptomatic subjects at risk for atherosclerotic disease. Let's paraphrase, or let's make that sound English. How many of you have ever gone to the doctor and been told you have a risk for heart disease or a family risk or have hypertension or have high cholesterol, and so you're being medicated to reduce your risk? Now, in all of those that answered yes watching this video, how many of your doctors have ever measured your glutathione status or your cysteine status to see whether or not your body had the tools that it needs to help protect against the inflammation that's driving cardiovascular disease? If you've watched my show for any length of time, you've maybe seen me talk about this, maybe not, maybe you're new. This is a blood vessel. And so what happens, what causes the plaquing to occur in a blood vessel? We get damage to the lining of the vessel itself. It's inflammation. And there are a lot of things that cause inflammation. Toxins to the body, food allergies, being exposed to toxic metals, multiple medication use, environmental pollutants, food dyes, food additives, food preservatives, bacterial infections, viral infections. It's just a lot of things that can cause this multifactorial inflammation. But once the damage is done to the wall or the lining of the blood vessel, the body will start laying down cholesterol in that area in an attempt to try to put out the inflammation, in an attempt to try to negate that fire. Well, one of the things that helps with dealing with this inflammation is glutathione. So, if heart disease is inflammatory in nature, and glutathione is the tool that our body uses to combat inflammation and to neutralize inflammation, instead of measuring cholesterol, which doesn't cause inflammation, cholesterol is just it's your body's way to patch the job, why aren't doctors measuring glutathione? This is something that can simply be done. I mean, you can measure glutathione in the serum, you can measure it in red blood cells, it can be measured intracellularly, you can measure the precursors for glutathione like cysteine. It's very easy to do, but very little or very few doctors do it. How many of you out there with heart disease as a diagnosis have had your glutathione levels measured? If you haven't, you should. According to this study, what they're finding is that if you have low glutathione, it puts you at greater risk for ischemic heart disease. And so when men have heart attacks, usually their first symptom is the heart attack. You can go your whole life for decades and not know, and then all of a sudden you have a heart attack, and many men, almost I think it's more than half, die from that first heart attack. But doctors are so interested in medicating blood pressure and medicating cholesterol that they're not asking the right question. What is driving the process of heart disease? It's inflammation. And if we don't measure the inflammation, or we don't measure what helps the body protect itself from the inflammation, we're missing a big chunk or a big piece of what might be helpful. Here's another research study. You can see here it was a clinical trial on long-term glutathione supplementation, offering protection from oxidative damage and improving hemoglobin A1C. Hemoglobin A1C is measuring average blood sugar over time. So it's the average blood glucose in about a 3 to 4 month span of time. And so you can see here in this study, supplementation with glutathione caused a significant increase in blood glutathione levels, which is important to understand because a lot of people will tell you that, and doctors are just as guilty of this, they'll tell you that taking supplemental glutathione, because it's a tripeptide, it won't absorb. Your body won't absorb a tripeptide very effectively, but that's actually not true. And I'll show you some research that validates that here in just a minute. But glutathione supplementation caused a significant increase in blood glutathione and helped maintain the baseline hemoglobin A1C overall. These results suggest that glutathione supplementation is of considerable benefit to patients above 55 years, not only supporting decreased glycated hemoglobin, which is hemoglobin A1C, right, that average glucose, but also at supporting or decreasing 8-OH-DG. This is a marker of oxidation. So this is a blood test that can be run that measures damage to your cells, to your DNA, and glutathione deficiency can cause an increase in this marker, but also increasing fasting insulin. So the clinical implication of our study is that the oral administration of glutathione potentially complements anti-diabetic therapy in achieving better glycemic targets, especially in the elderly population. Again, this is a human trial, not an animal trial. If we had a government that was funding, great science all the time, we would be funding a lot of nutritional science. Most of the funding goes to drug and pharmacotherapies, which it's all fine and good, but I think a good chunk of that money needs to be going at nutrition, because nutrition is where it's at. And you see here in this particular study published in BMC Gastroenterology, efficacy of glutathione for the treatment of non-alcoholic fatty liver disease. And so you see here treatment with glutathione. In this case, it was 300 milligrams a day for 4 months. That's what the parameter of the trial was. And the result, 29 patients finished the protocol. ALT levels significantly decreased following treatment with glutathione for 4 months. In addition, triglycerides, non-esterified fatty acids, and ferritin levels also decreased with glutathione treatment. Well, why is that important? Triglycerides are fat in the bloodstream that increase fatty liver and increase the risk of heart disease. It's one of the markers most cardiologists will measure regularly when you go in for your checkup. So what they're saying is glutathione, in effect, lowers triglyceride levels. Ferritin was also lowered by glutathione. Ferritin is an indicator for inflammation. So it's what's called an acute phase reactant protein. It's a protein released by the liver when the liver's inflamed. So if you have high ferritin levels, what this study is showing is glutathione was actually helpful at lowering those elevations. Again, glutathione has a very anti-inflammatory effect, and the suspicion is that's why it works.